Welcome back. We are talking birth control here at St. Helena Women's Health Center. Not that we don't want you to get pregnant, we do. We love taking care of babies at the family birthing unit. It's fantastic and an amazing view. But for those of you who aren't ready or who have already had enough, there are amazing options for birth control. Let's talk about that. In fact, in recent years, we've come up with some really neat stuff. Some stuff that works great, and like everything I always tell you, everything has side effects, but even if you don't use anything, it has side effects, because if you get pregnant, you get side effects, right? At the end of the day, birth control comes in many different packages in different ways. In general, there's two ways to look at birth control. There's hormonal and non-hormonal birth control. Let's talk about the non-hormonal birth control first. Most of that hasn't changed a whole heck of a lot. Non-hormonal birth control, the best of the breed probably is abstinence. It works. You don't get pregnant. It just works probably better than anything else, right? But it's not as fun, and we don't do it. People do things like withdrawal methods or fertility awareness method, timing, a number of different names that have been put on to the natural family planning methods, which are completely reasonable. And in fact, if you really take it seriously, natural family planning, which involves no hormones, but it does involve significant work or effort on your part to know when you're ovulating, when your most fertile times are, and to sort of not be in the same place at the same time, at least not naked, to experience those times, because that's when you're going to get pregnant. But the fact is that when you look at the success of natural family planning options, in general, those options are relatively poorly heeded to. Pulling out, for example, not a great idea. When you start having sex, there's often a pre-ejaculation that has 50, 100,000 different sperm in it. It only takes one. Sure, it's not nearly as common that you're going to get pregnant with a small amount, when normally you may have on one natural ejaculation 2, 3, 5, 10 million sperm. At the end of the day, it only takes one of them, and it only will take one of them. So it's probably not a good idea, and it's probably why most of the natural family planning, on average, failure rates are the highest. Failure rates in the 10, 15% range are common. But truly done religiously, if you will, for lack of a better term, if you truly do natural family planning methods, meaning checking your temperatures daily, or ovulation predicting kits, knowing exactly when you're fertile and when you're not, and being prudent in that process, you can actually get your pregnancy success rate or prevention rate down about 99%, 98, 99%. But it takes a lot of work. And just missing one temperature may be the one that you didn't want to miss, if you know what I mean. That being said, there are other non-hormonal options. Those include, of course, condoms. Condoms are prevalent. They are great. They work if you use them from the beginning rather than sort of after you start. Oh, wait, second thought. Need a condom? Not so good, because then that pre-ejaculation is still at play. But if you use them from the beginning and they don't break and you use them appropriately, pretty good success rate, anywhere from 3 to 6% failure rate. On average, the failure rate's much higher than that because people don't use them correctly, or because they break, or you just didn't get a good batch. But at the end of the day, better than nothing. The average rate of pregnancy in a 25-year-old, for example, from one cycle of her potential for pregnancy is as high as 20 to 25%. So just trying and having sex during the course with nothing protecting you, as much as 20 to 25% risk of a pregnancy for that month. Other non-hormonal options include diaphragms, sponges, and there are IUDs. IUDs, intrauterine devices. These are instruments that are actually put inside the uterus, typically by one of us at St. Helena Women's Health Center or another provider, and they're put inside the uterus to block the connection between the sperm and the egg. They make the environment inside the uterus very inhospitable, very unhappy for sperm to survive, and ultimately for a sperm and egg that might have inadvertently met to actually implant in the uterus. It's still not perfect, probably 1% failure rate with the non-hormonal IUD, but a good option for many women. At the end of the day, There's not a lot of other ones. Sponges and diaphragms I talked about briefly. Failure rates are very high, particularly for women who have already had pregnancies, successful pregnancies. It's much less likely that those would be strong options for women. The next category are, and again, this is all temporary that we're talking about at this point, the next category are hormonal, and they're the vast majority and the more successful means of preventing pregnancy. As of yet, there aren't any for men, but we're working on it. Of course, you got to know men invented this stuff, because that's why we're not taking it. We're not as noble as maybe we like to think we are. But at the end of the day, we're working on it. There's probably a few fellow female scientists out there that are helping us. But at the end of the day, that we will have something for men to actually prevent the sperm from being produced or being released. I do believe that there have been recent studies that have been showing success in a significant way for the first time. Don't look for them next week, but in the next several years, it wouldn't be surprising if you see the first products coming out. That being said, what are the hormonal options for women? The most common option is the pill. The pill is been around for 50 plus years. I've talked about it here before. It was designed many years ago to prevent pregnancy. Long story short, you typically take it every day, usually the same time of the day. It's pretty easy. Side effects are different for different people. Some women have many more side effects, others have very few. There are some risky side effects, some severe side effects, blood clots in the chest and legs, a stroke. Those are risks from the birth control pill. But there are also risks from pregnancy. They relate, we believe, to the estrogen levels in these pills, and in particular the estrogen levels in pregnancy, which are 10 times higher than any pill or product that we would give you. But when we do give estrogen, because it can cause those problems, some women are at more risk. Some women have family history of strokes that are extensive, or blood diseases, blood changes, certain products that are inadequately represented in the blood that may put them at more risk for blood clots. Sometimes we can know that in advance, and sometimes we just don't know. But at the end of the day, it's not common to have a great deal of risks with birth control pills, and they work great. On average, about a 1% failure rate. But that's if you take them. It doesn't go in your mouth automatically. In fact, we did an interesting study. We looked at women who took the pill and thought that they took the pill every time. On average, we asked, did you take the pill every day within this hour period that you're supposed to take, because you should take it every day at the same time of the day. And I think something like 80–90% of the women thought that they did, but when we looked and actually measured when they took the pill, because the pills had these little cool computer things on them, that when the pill was pushed out, it was recorded, time and date stamped as to when it happened. Now, it didn't go in your mouth. We didn't know for sure you took the pill, but assuming if you pushed it out, probably you took the pill. But just the idea of thinking that you're taking the pill 80–90% of the time, only less than 50% of the women actually took the pill on a regular basis appropriately, based on what we talk about every day, same time of the day. That's pretty amazing. More interesting was when we asked women, did you miss a pill? A huge percentage of them, the vast majority of them, didn't think they missed any pills. But when you actually looked, they didn't push the pill out about 20 to 30% of the time. And if you don't take the pill, they don't work. And then worse, because usually one pill isn't enough typically to get you there, but 2 pills may very well be enough to get pregnant and to have the system fail. As much as I think there was 15%, if I'm not mistaken, of the women who did this study didn't take 2 in a row. But only 2% thought that they didn't take 2 in a row. So think about it. It's hard for us to remember these things. Kind of interesting study. That being said, there are many other options that somehow take advantage of that weakness in pills and come up with a different approach. So there's a patch. There's a patch that you can ring. Wear on your back of your shoulder, on your belly, on the back of the hip. It works great. But it has probably more side effects, a little higher doses of hormones and estrogen, and in fact has been shown to have more risks of blood clots and stroke. Not monumentally so, but more risks, and has really kind of fallen out of favor. So you don't see a lot of those being used, though they're technically still available. There's the ring. The NuvaRing is the only ring actually on the market. This is a ring, a vaginal ring. It goes inside the vagina, and it sits there. It functions just like a pill. But of course, you don't take it orally. You put it in vaginally, and it's easy to do, easy to put in, easy to take out. Maybe not for everybody, but 98% of women found it easy to put in, and 99% found it easy to take out because it's a ring. It doesn't get lost. It's not dangerous, it's not scary, but it has the same potential risks as do pills. In fact, interestingly, there was a study that has recently concluded that looked at the risks of the ring as it compares to pills. And in fact, the ring had less risks in this multinational, large study of women, prospective study, to look for those risks. It had less risks than the pill, contrary to our legal friends who like to advertise late at night on TV. But I see more and more of those coming off. They're still doing the products, but this one's not any longer in the limelight. At the end of the day, that's a great product. It's one that I like because it's flexibility. It's something you can use vaginally once a month. You don't have to take anything orally. There's a number of benefits that we think when you take hormones through the skin, both with birth control and with hormone replacement. When it goes through the skin, it doesn't get affected by the liver in the, quote, first pass, whereas it does when it gets absorbed through your stomach. And that process is probably the heart of the matter in terms of problems as it relates to birth control or hormone replacement in general. It causes a great deal more changes in the hormones in the body and inflammation, putting us at more risk of things like blood clots, stroke, and heart attack. That probably doesn't exist, and probably is the reason why the study showed that NuvaRing actually had less risk. At the end of the day, it's a great option, but there are many other options. There's the implants. Now, implants are extremely successful at preventing pregnancy. They are in fact, they're more successful than many of the permanent sterility options, the permanent types of birth control, like tubal ligation or a vasectomy, for example. That's one for men, which I wish more would use, frankly, because there's really few risks. The implants, though, back to those, they've gone through a long history. We used to use 6 little tubes, about yay big, that would fit in the inside of the arm here. Well, that was great. It worked great. Lasted for 5 years. It was very successful. Less than maybe 2 or 3 women in 1,000 would get pregnant each year as a failure of those. So pretty powerful stuff. And then they would come out after 5 years. But that was the problem with the original one. It was hard to get them out. Sometimes people didn't put them in right, so they were harder to get out. But now they've kind of fixed that problem. There's one tube now, one rod, if you will, that's implanted. They last for 3 years. It's a very simple process to implant and a very simple process to remove. And it's only a tiny little incision, literally about 2 millimeters to 3 millimeters in size. Something that is tolerated very, very well and is done in the office. That works great, but it's not for everybody. We have an IUD, another intrauterine device, called the Mirena, which is one of the most successful ways to prevent pregnancy. It lasts for 5 years. It does have hormones, no estrogen though. So it's good for women who have a history of blood clots, for example, or have a history of heavy bleeding. Sometimes just putting in an IUD, even if you don't need birth control, is a great choice for women who have heavy bleeding, and it doesn't involve any surgery or really any significant risks. That's a great option, the Mirena IUD. It's the only one on the market of its kind, so I use the brand name. Normally I don't try to use brand names. Looking at that effectiveness, less than 1 to 2 women in 1,000 in the first year will get pregnant, and it just gets better. It lasts 5 years, your periods are super light, very little risk of anemia. In fact, some women don't have any periods at all. But the bottom line is, well tolerated by most women and a great option for women who are breastfeeding, for example, or women who are older, who are looking for a secure means and they don't want to think about birth control with pills, or particularly for smokers. Not that we want any of you smoking, that's a whole other discussion, but if you're a smoker, birth control and pregnancy are not your friends. They put you at much greater risk of having blood clots, stroke, and heart attack. And so we don't want to have any of that, obviously. At the end of the day, that same risk isn't true when you have a progestin only, like the implant or the Mirena that we talked about. And then finally there are the permanent options. And permanent options we've talked briefly about in terms of the Essure, E-S-S-U-R-E, a brand name, again, the only one on the market, which is an implanted device that goes through the cervix and into the tubes and stops pregnancy cold. It's probably the most effective form, other than abstinence, of birth control that we have. Very easy to do, but it's permanent. You don't do it if you think you might want another child. And then other permanent options are the vasectomy that we've talked about for men. Very, very excellent outcomes. Perhaps 7 in 1,000 failure rate. And largely that's because people don't wait enough time to make sure that it's ready, because it does take a little bit of time for the sperm to clear, so to speak, and then for you to be protected. And the other types in terms of tubal ligations, either right after having a baby or laparoscopic tubal ligations, closures, cutting, removing the tubes, all different options to permanently remove the risk of getting pregnant. Some are better than others. Very few, if any, are perfect. And you are perfect, and you are our friends here at St. Helena Women's Health Center. We thank you for coming again. It's a long talk today on birth control. We hope you enjoyed it. Hope it made some impact. And if you need any help, please call us. Let us know how we can help you. And have a blessed day.